TGIF. In this video, I'm going to talk about best time to take diabetes medicines and insulin. There's always some confusion, so I'm going to clear that up hopefully with this video. I hope you guys are doing well for Friday and excited about this coming weekend. Okay, so when you take your medicine can be just as important as what you take. Let's understand the best timing for diabetes medicines and insulin so your blood sugar stays stable throughout the day and night. Why timing matters. So our body's blood sugar fluctuates with meals, hormone, stress, sleep. So taking a tablet or insulin at wrong time can cause either sugar spikes or sudden drops, causing hypoglycemia. So the goal is to match the medicine's peak action with your body's sugar peak spike, usually after meals or early morning. So correct timing also helps prevent side effects like hypoglycemia, stomach upset, or fatigue. So let's talk about the morning medicine and why they should be taken in the morning. So that's the whole thing. Why certain medication should be taken in the morning, why certain medication should be taken in the evening, why certain medication should be taken with food, before food, and things like that. So morning medicine, in the morning, your body sugar naturally rises. It's called the dawn phenomenon. So in the dawn, that's in the morning, body is preparing you for waking up and starts putting some hormones in your body so that blood sugar is higher for activities. That's why certain medicine work best with breakfast or shortly after you wake up. Metformin, glucophage, Fortamet, other names. The most common first line medicine we use. You got to take it with breakfast to reduce stomach irritation or to help your liver reduce morning glucose output. Januvia, sitagliptin, or Tradjenta, linagliptin, they are DPP-4 inhibitors that help control post-meal spikes. So usually you take that once a day in the morning. So it's controlling the spikes after breakfast, after lunch, and after dinner. Jardiance, empagliflozin, and Farxiga, dapagliflozin, they are called SGLT2 inhibitors that help eliminate excess sugar through urine, and morning is the best since they may increase urination. Glipizide, which is glucotrol, or glyburide, which is diabeta, should be taken half an hour before breakfast, or if you're taking twice a day, half an hour before lunch, so that the insulin release peaks when you start eating. Because both medication, they squeeze pancreatic beta cells to release more insulin. Actos, which is pioglitazone, can be taken any time of the day, but the important thing is that you should be taking around the same time every day because consistency really matters when it comes to diabetes. Many prefer to take it in the morning. Now, for natural support, some people take berberine, cinnamon, Gymnema. They are good to be taken with breakfast because they improve insulin sensitivity and help blunt that early morning glucose rise. Evening medicine. Some medication, they act better when taken at night. So Metformin ER, extended release, or called Glipizide ER. Evening dose really helps to control the overnight glucose release, okay? Now, if you're taking Metformin ER twice a day, so it really doesn't matter, you take one in the morning, one in the evening. But if you're taking only once a day Metformin ER, then take in the night time. Basal insulin. Basal insulin is one that controls the background sugar in your body 24/7. Those are long-acting one: Lantus, Basaglar, Tresiba, Tuzio, Levemir. They're usually taken before bedtime for a stable fasting sugar. They also help to control dawn phenomenon. So that's really important. I want to also mention a statin, because most of the patients who has diabetes, they need to be on a statin unless you have contraindication. So if you're taking pravastatin, simvastatin, best time to take it at bedtime. Fenugreek and Ceylon cinnamon capsule, they are natural supplement, and they slow glucose absorption from dinner and help keep fasting sugar stable overnight. So if you're taking fenugreek supplement or Ceylon cinnamon supplement, take it at night time. If you're taking Berberine and Gymnema, they should be preferably taken in the morning. Now, insulin timing, and what is the logic behind it? That's really important. A lot of people on insulin these days, even type 2 patients, that's where my focus is right now. So insulin timing depends upon the type of insulin you use, right? So you have a rapid acting insulin, and then you have a basal or long acting insulin. And some people also use regular insulin because their insurance company, they're stingy, they don't want to cover for, either long acting or rapid acting one. So in rapid acting insulin like Lispro, Humalog, Novolog, Aspartate, Fiasp, you got to inject 10 to 15 minutes before meals to control meal-related spikes. And they are rapid acting. Within 15 minutes, they are at peak. Regular insulin, Humulin R and Novolin R, you got to inject 30 minutes before eating because they act slower. Basal or long-acting insulin like Lantus, Tresiba, Tuzio, Levemir, you got to take it the same time daily, preferably at night time, at bedtime. For once a weekly injection like Ozempic, semaglutide, or Trulicity, dulaglutide, or Mounjaro, Trizapatide, you got to choose a consistent day each week. Time of the day doesn't matter much, but the day of the week matters most. Never skip meals after insulin or sulfonylurea like Glipizide, and always rotate your injection site to prevent lipohypertrophy at the site of injection. You need to integrate your lifestyle. Medicine, insulin work best when you have a good lifestyle habits. Eat dinner early, keep it light, walk 10-15 minutes after a meal. That's going to reduce your post-meal sugar spike. Sleep on time. Poor sleep raises fasting sugar. Manage your stress. Chill out. Cortisol, because cortisol pushes glucose higher. And if your doctor agrees, add some herbal adaptogens, Berberine, Gymnema, cinnamon for additional natural support. Remember, the blood sugar control isn't just about loading numbers. It's about synchronizing your medicine, meals, and metabolism. So I'm Dr. Karan from DrPKLyfe. Let nature and knowledge help you heal. Stay healthy, balanced, and have a nice weekend. Thank you for watching.